go over those in lecture, and we'll use some slides to go over that too. So let's just go over a couple things on this heart to look at. And it's almost going to be, let's go over the flow of the heart, flow of blood through the heart, the upper left-hand side of your sheet. We're going to start with blood coming from the body. So it's already been passing through all your tissues, and the oxygen level is just a little bit lower than when it started off. So it's called oftentimes deoxygenated blood, but it's actually low oxygen. It's not, there's still some oxygen in it. It's going to be coming from your head and shoulders through this large vein here called the superior vena cava. This is draining your head and shoulders. Your chest and lower regions are drained by this inferior vena cava. So blood's coming from your chest and lower regions up into the heart through this lower vessel here, the inferior vena cava. So the superior and inferior vena cava are bringing blood to the heart from the body. It's bringing it into this top chamber here. This little outside structure here is called an auricle. Your books will point to it, call it atrium. That's okay, this is being sloppy. You take the front of your model off, and you see that there are chambers, 2 upper and 2 lower chambers. Superior and inferior vena cava are going to bring blood into this top right chamber called the right atrium. This chamber here is the right atrium. When the right atrium contracts, it forces blood past this valve. This valve, we'll talk about, has 3 flaps to it, or 3 cusps, called the tricuspid valve. And the blood will be in this lower chamber here called the right ventricle. Now when the right ventricle contracts, this valve slams shut. It's a one-way valve. So another valve has to open, and it's right here. This is the bottom of the valve here. This is called the pulmonary semilunar valve. Some books just call it the pulmonary valve. Pulmonary semilunar valve. Once it passes that, it's in this structure here called the pulmonary trunk. The pulmonary trunk is actually an artery. When you see it goes up, it splits. So you turn the heart around the back, and you see that it splits into 2 branches. Okay? This is going to be the right and left pulmonary arteries, and they're going to take the blood to the lungs. The right and left pulmonary arteries takes the blood to the lungs, where oxygen is going to be picked up, carbon dioxide is going to be released, or gotten rid of out of your blood, right? And the vessels that are bringing the blood back from the lungs are these 4 here. There's 2 there, and there's 2 there. Okay, those are called the pulmonary veins. They're bringing blood from the lungs back to the heart. Now they're going to bring it and deposit that on the left side of the heart, this top chamber, the left atrium. So blood returning from the pulmonary veins comes into this left atrium. When the left atrium contracts, blood's forced past this next valve here called the bicuspid valve, or the mitral valve. When it passes the mitral valve, it's in the left ventricle. Left ventricle contracts, that bicuspid or mitral valve is going to slam shut. So, this valve right there, you can see the bottom of it, the aortic semilunar valve, is going to open. And when the aortic semilunar valve opens, it allows blood to enter into this aorta, which will take it to the body. Here's the aortic arch at the top where it bends over, and the blood goes out to the body. All right, so that gave us structure names. We went through the flow. But let's look at what these are called. Some of these little branches off of here. There are 3 branches. The first branch off the aorta is called the brachiocephalic artery. Brachiocephalic artery. Brachio means arm, right? And cephalic means head. So what's going to happen is this is going to come up and it's going to split like this. A branch will become the subclavian, another branch will become the right common carotid. So brachiocephalic is it's one vessel that's going to split into two. One going to the arm, one going to the head. So the right subclavian and the right common carotid are going to come off of this one. The next branch off is the left common carotid, and the third one is the left subclavian. So we have 3 branches off the aorta there that are on your list to know. All right, some other structures on here. There is a wall in between the ventricles here. Here's 2 ventricles down here. There's a wall in between them. It's called the interventricular septum, between the ventricles wall. Also, together, this is the apex. The tip is the apex of the heart, and the base is up here. So the base is the top, no specific spot, the top. Where it comes to the tip, that's the apex. You're going to have to get a little closer to see them, but there are 2 arteries that come off this aorta, and you can see one of them right there coming right off the aorta. You can't see the other one coming off right off of it. This is the right coronary artery. Comes off the aorta. The left coronary artery, it came off and it went behind this trunk, and you can see it right there. There's the left coronary artery. So you can see that one right there. Those coronary arteries are the 2 arteries that supply your heart with blood. Okay. Now when you put this on, you can see some of the branches. The right comes around here to the right side and has some branches off of it. The left, though, behind here, it splits. It splits behind here. You don't see where it splits, but it splits. This is the anterior interventricular artery on the front side, goes between the ventricles. And then the one that goes around the back is called the circumflex artery. You can see this one goes around the back. It's called the circumflex. Those are how the heart gets its blood. It's a pump, but it's a muscle. And this muscle has to have some blood going into it, too. That's how it gets its own blood supply, is through those vessels. Then, venous blood returns to the heart, and it pools back here. This is called the coronary sinus, this big blue vessel here. It's called the coronary sinus. It's where all the venous blood pools on the back of the heart, right here. And then again, you take the front off, and there's an opening right there. That's the opening of the coronary sinus. This venous blood is going to be joining all the other blood coming from your body, from the superior and inferior vena cava, in this right atrium. So the low oxygen blood coming from the heart is going to be blended in with the low oxygen blood coming from your head and shoulders by way of the superior vena cava, from your chest and lower regions by way of the inferior vena cava. So it's entering into this right atrium again. Okay? That should give you a little bit to look at. Any questions? We'll talk about the valves in class, okay? That's a little more detail.